In today's video, we will discuss how to interpret CSF analysis report when we do lumbar puncture in a suspected case of meningitis. First, when we are doing the procedure and when we are collecting CSF fluid, we have to focus upon the opening pressure, which can be measured using spinal manometer, and normally the values will be 50 to 180 millimeter of water. These 2 points we have to remember. And how does it help? For this, we can just say usually it will be elevated too much in case of cryptococcal meningitis and bacterial meningitis, but not much elevated in viral and tubercular meningitis. This is the first point related to CSF pressure, opening pressure. Then the appearance will also tell us few points. Mainly here, I want to mention, you can consider it as mnemonic. So when we are analyzing CSF report, just remember CVT, B. So commonly we know CVT, cortical vein thrombosis, and B. These words we have to remember. So how does it help? When it comes to appearance, in these 3 groups mainly, that is cryptococcal, viral meningitis and tubercular, majority of the times the fluid will be clear. Whereas in bacterial meningitis, it will be turbid. And sometimes we can see cobweb or slight turbid appearance in tuberculosis as well. Slightly turbid or cobweb formation we can see in the fluid, but it will be usually clear in case of cryptococcal and viral. So CVTB is the word which we have to remember as the initial step of analysis. Then after opening pressure and the appearance, we have to focus upon the number of cells and the type of cells. When it comes to number of cells, again the same word will help us, CVTB. Usually in these 3 conditions, the cells will be ranging from 10 to 500 we can say. Whereas in case of bacterial, cells will be ranging from 1000 and above. So this point again it will help in differentiating. So if you are seeing the cell count in the range of 10 to 500, it can be due to viral, cryptococcal as well as tuberculosis. But if you are seeing drastically increased cell count, that is an indicator towards bacterial meningitis. And once cell count is done, we have to focus upon the cell type. So how does it help? We have to look for the predominant cells in the report. Suppose it is neutrophil predominant pattern. Again, it is bacterial. Here also CVTB word will be helpful. If the predominant cells are neutrophils, it is bacterial. If the predominant cells are lymphocytes, it can be among these 3, viral, tubercular, cryptococcal. So till now, we have focused upon the opening pressure, appearance of the fluid, number of cells and the type of cells. In all these things, we have utilized CVTB. So these 3 will give the similar findings and the bacterial meningitis will be quite different during analysis. Now we have got numerous clues towards bacterial, like it will be turbid appearance, there will be drastically increased cellular count and predominantly it will be neutrophils. But we are not sure how to differentiate among the other 3, that is cryptococcal, viral and tubercular. So next thing which we have to focus upon is the glucose ratio. Glucose ratio in CSF bar serum. So when you are sending for the CSF analysis, always send the serum glucose value as well, so that it will be helpful in calculating the ratio. Usually CSF will contain about 40% of glucose which is there in the serum. Normally we can say about 100 milligram per deciliter of glucose will be there in the serum, suppose. Then it will be 40 milligram in the CSF, 40% of the serum. This is normal expected value. Now we will see how does it help in case of meningitis and CSF report analysis. So as I mentioned, 0.4, that is 40% is the cutoff. Now here what we will do is, the previous word was CVTB. Now this V has got bored by sitting in the middle of C and T. Now it wants to get replaced. So what it will do? It will be freed away and B will come and sit here, just depicting as a story. So now the wording will be CVTB. So the point here is, in case of viral meningitis, the ratio will be more than 40% or normal we can consider. Like the glucose value will be as expected. So it will be definitely more than 0.4. Whereas in other three, that is CBT, cryptococcal, bacterial and tubercular, glucose is reduced to less than 0.4 ratio. So this is again very important. Why glucose is reduced? Because when compared to viral, these three infections are a high inflammatory state, we can say. So because of increased immunological demand by immunological cells, they will be utilizing more glucose for the functioning, leading to reduction of glucose in the CSF, where the actual fight is happening between the infective agent and our immunological cells. This is regarding the glucose ratio in CSF and serum. Next point we have to focus upon is on the protein levels. So just now I mentioned that when we compare the immunological fight to all of these infections, we can say that extent of fight is lesser in case of viral compared to cryptococcal, and it will be lesser in comparison with bacterial, and the fight is more severe in case of tubercular meningitis. So what does it mean? Our body will be recruiting more amount of immunological chemicals like antigen, antibody, all these things will be more to clear if it is tubercular meningitis. So all these antigen, antibody or other immunological chemicals are nothing but proteins. That's why in this severe fight, definitely protein levels will be higher in tubercular meningitis. Similarly, body will try to fight with good number of immunological chemicals even in case of bacterial meningitis. But the fight will be to some lesser extent in case of cryptococcal and viral, where the recruitment of these chemicals will be comparatively lesser, leading to either normal or slightly elevated protein levels in the CSF. So if you are seeing very significant elevation in the protein compared to the normal range, it will be either bacterial or tubercular. Suppose the protein levels are in the normal or slightly elevated range, you consider it as viral or cryptococcal. Depending on the severity of the fight, the protein parameters will be increased. And finally, for definitive identification of the organism, we can take help of microbiology. For example, when it comes to gram staining, usually it will be positive in bacterial meningitis and it will be negative in all other three types of meningitis. And culture, bacterial growth is common, whereas viral meningitis, usually the culture will be negative, and for tuberculosis, it is quite difficult to get the culture, and in case of cryptococcus, fungal culture can be variable. And when you want to look for the exact molecular structure of the infective agent, for bacteria, again we can send for PCR depending on the expected microorganism. For virus, many of you might be knowing, we have viral panel where we can look for the PCR of numerous viruses leading to meningitis. And for tuberculosis also, PCR is available. And in case of cryptococcus, we can look for antigen using molecular techniques. So in summary, we can say that whenever there is bacterial meningitis, usually what we will see is turbid nature of the collected fluid, and there will be neutrophilic pleocytosis, and the cell count will be usually having a more spike with lower glucose, that is the ratio will be less than 0.4. And what about proteins? Definitely proteins will be increased. This is the typical picture in bacterial meningitis, and sometimes we will be lucky enough to get gram stain positivity or culture positive report. In case of viral meningitis, the CSF fluid will be usually clear, and when it comes to cell type and cell count, we see lymphocytic pleocytosis, and the glucose ratio will be normal and protein will be usually normal or slightly elevated. Whereas in case of tuberculosis, we see cobweb formation or slightly turbid fluid. When it comes to cell count, usually it will be lymphocyte predominant, and glucose will be depleted, and the hallmark is very high levels of protein. Whereas for cryptococcal meningitis, the priority is the individual will be immunocompromised, commonly associated with HIV. In that case, when we look at CSF, usually the fluid will be clear and slightly elevated cell count will be there. Glucose will be lesser than the ratio, which is less than 0.4 we can say, and protein will not be much elevated, either it will be normal or slightly elevated protein. And you know, Usually, whenever we think of cryptococcal meningitis, we will send for Indian ink preparation, which will be positive in case of cryptococcal meningitis. This is the overall point about CSF report interpretation. And regarding opening pressure, which I have mentioned in the first slide, at majority of the places, the spinal manometer will not be available. But if available, measure it and look for the elevation of opening pressure, which is significantly elevated in case of cryptococcal meningitis. I hope this video will be helpful for residents who will deal with meningitis cases repeatedly. And don't forget to recall the mnemonic CVT V for the initial 3 steps. Then just replace V with the B, that is CBT V. Then just think of the severity of fight leading to protein recruitment. Severity of fight. This sentence will help you in proper interpretation of the CSF report. Share it among your friends. For more such informative, clinically useful videos, don't forget to subscribe our channel.